kidney disease. It happens. This guy's had 2 transplants. 61-year-old guy, friend of mine.
Yes.
Will Smith with us today, guys. Unbelievable case. Here to teach us what's going on. How you feeling? Good to see you.
Good to see you, Doc. I feel great. Thank you so much.
Thank you so much.
Yes.
He's been a patient of mine. 12 years.
12 years.
Let's go.
Feeling good.
All right. So this guy is a beast. This guy is a hero with the United States Navy, and he was diagnosed with kidney disease, not from steroids. 31 years old, way back. He's going to bring us through his life and where he is today. And we're going to talk about understanding some things that are common and not so common. When you're just gambling and you had it, wasn't your fault, but you got through it and you're killing it today.
Yes.
Tell us the story. I'm Dr. Thomas O'Connor, a lifelong powerlifter, board-certified physician, and published academic author. I've taken care of thousands of men on testosterone and steroids, and now I use my media appearances in this YouTube channel to provide education and harm reduction. Subscribe now so I can help you stay strong and healthy.
Well, I was, in Italy, stationed there, training, working out, and I was winning several natural competitions.
Right, you were bodybuilding before.
Bodybuilding and doing great, and all of a sudden I started experiencing swelling,
Right.
headaches, and shortness of breath was the biggest one. But because I was in such good shape, it just kept blowing it off.
How much do you weigh?
And I was weighing about 240.
You're 6'2".
I was 6'2", 240. Probably had some puffiness there. I didn't realize it, but at that age you thought, hey, I'm big, so that's just the way it is. But I was competing about 25 pounds lighter, and I was getting back pains, and then it was the vision that started. But the day that got me the most was when I went to the hospital and my blood pressure was 265/177.
Wow.
Yes, so there they were asking me questions, are you on cocaine and what's going on? I'm like, what the heck is this? And basically sent me home. Till I woke up one morning, I had blood coming from the eyes.
Jeez.
And that's when I went in, actually crying to the doctor saying something's wrong. They did a blood test and my creatinine was 11.
Wow. How old were you at that time?
I was 31 at the
31-year-old guy. Just a natural big man, 240, 6'2", American Navy man. I know you had stories all over. Yeah. You were how many years in the Navy?
I was 14 years in the
So
Navy.
A professional Navy guy,
Yes,
really, and just strong, a beast. Tells me some stories where like they would kind of bring him out with other men and stuff and kind of show off the American guy.
Yeah, right.
And it was just like an intelligent, nice guy, and he's very quiet and just like stand him up over here and just like lead the way. So you're there, you're having a great life, you're super clean guy. I'm not against guys on steroids, not at all, but this man didn't do steroids.
Right. We would get tested all the time. You have to make sure you had to stay clean.
Right.
And matter of fact, at the
But
time,
you didn't want to do steroids.
I didn't want to do steroids. Didn't even drink. I was
Just a regular guy. Just a regular
guy.
Boring, we got called a boring American.
Right.
Okay. So he's diagnosed over months where, if we look at the story, hypertension's off the chart. He just didn't know it. He didn't really feel it because it's a silent disease. Of course, in the end, you had just puffiness, ankle swelling. I know you just were short of breath. And obviously, at a certain point, the eyes, there's so much pressure that you were basically blind and just blurry vision and
could not see while I was driving. I was following the taillights of cars trying to get to the hospital.
So, and this is in Italy, and there's nothing against Italy. It's a great country, and
Yes.
they're allies of ours. So you're there as a military man, and otherwise, out of nowhere, this happens, and this is where it's a very interesting story. So now we're going to go through that you've had 2 transplants.
2 transplants.
Two! This guy's 61.
Both
You should see this
God.
guy's body. I mean, this guy is just a beast.
And both my donors are live donors. So 2 ladies. I appreciate them. Thank you so much.
Wow, thank you so much for that. So, but let's go back. Let's start. What's the diagnosis that they said way back when? Because you didn't have a history of diabetes, didn't have a history of any steroid use that's the FSGS that we see today, which is sad. I got to bring attention to it, guys. So he just had a congenital condition, and it just was one out of, or less than one out of 100,000 or so. Now, what did they tell you?
They first told me it looked like I had glomerulonephritis.
Right.
And they were thinking it happened because I had the strep infection.
Post-streptococcal glomerular nephritis. Woo! Right.
Yes.
This is rare. And if you look at the incidence, we looked this up, it's outside of America, it's higher. It's like 25 or maybe up to 100 cases per 100,000 in developing countries, lower socioeconomic. American, it's different. It's much less.
Much less. Yes.
So but you were in Italy, which is it's not a developing country. It's one of, and you got to be careful with the politics and this bullshit. But it's like, we're American. You're working with the Allied forces, if you will, and you're healthy. And there's no drugs and alcohol. There's no really deadly diseases. But it looks like he had a rare case. You see this more with children, of having an infection of strep.
Yes.
Strep. It's usually a skin infection, but this time it was just an upper respiratory infection.
Upper respiratory, but I was in such good shape. It could have been, I've had it before. I had a little pain in the back. But, we just took Motrin and went on.
But they gave Motrin, which on top of the hypertension, because the kidneys were going down, was exacerbating it. It's Monday morning quarterbacking, not putting down the doctors at all, but they didn't really know. But it is, I think it's tough that we can look back and it's like you were in the hospital a couple times, or you went to the clinic, and the blood pressure's off the chart, and he's like, guys, something's wrong. And they were like, I'm not sure. He looked so healthy.
That's what it was.
He looked so, talk about discrimination. They just think he was a healthy stud, 31-year-old man. Right. Get out of here.
Yes.
And he has to come back a couple times, and his creatinine is 11.
11.
Okay. Tell us the story, how they got you out of Italy.
That was hard. So they shipped me over to the Italian hospital, and there we were contacting the command. They was telling them that I actually was doing dialysis, and it was doing dialysis from my leg. And they told them that I would have to do dialysis and I had to have it removed, but I had to wait 6 hours after dialysis. That's when the clock started ticking, that they had to get me to America and get a new treatment in my chest, a Hickman shot. And I would have to do dialysis within 21 hours or I would die.
So because he was in acute kidney failure when his creatinine was 11, didn't you go into cardiac arrest?
I coded on them. I don't know if it was cardiac arrest, but I felt myself when I went in and the nurse was helping me go to the restroom, and I said, I can go by myself. And I looked at her and said, oh God, I'm dying. And I dropped there, coded there. That was the first time. So
probably from the hyperkalemia, from the potassium.
Yes.
And just the fact that you were in a medical facility, it's a grace of God.
Yes, it was.
If you coded somewhere out, people die when they don't know this in their home, or they're outside of a medical institution where they don't have the equipment to save someone's life rapidly. And that's an amazing story. So you get, they dial a lot, they have to put immediate catheter in to dialyze. You're getting the dialysis, probably feel better. Then they're like, all right, we got to get this guy back to America.
Got to get me back to America once they figure out what it was. And for some reason, the one executive officer at the one NATO command did not want to get me tickets to get out. She wanted me to go what they call a medevac flight. And at the time, the medevac flight left Italy, went to Yugoslavia, went to Germany, went to Spain, and then went to the U.S. It was 3 days.
Kind of sharing an Uber with people.
Right. And it was told that I had to do it within 21 hours. And it was funny, at that time when I was refusing, they actually tried to come and get me one night from my room.
Oh, wow.
Yes. And thankfully, as I'm yelling for help, the Italian nurse came in and said, what's going on? I was like, prego, which is, please help me. And then I heard the most beautiful voice It's an Italian nurse with a deep voice. He said, "Put him down." Great voice.
Yeah. Love it.
So during that time, we're still trying to get tickets to get out, and we actually had to have called my congressman.
Wow.
From Maine, Congressman Allen. I want to thank him. It was he that got me out.
Wow. How long ago was this?
That was in 1998, 99.
Okay, so you get back in America, and then let's keep going with the kidney story. What do they do?
First thing they do, they send me with a doctor on the plane. I land and Bethesda Naval Hospital, great hospital, had the ambulance out there waiting for me in a gurney, and I walk off the plane. And that's when the guy, corpsman, said, "You're in kidney failure. You walk off the plane. We've never seen this before." And I made the joke, "Well, you never met me."
That's awesome.
And so I went to Naval Hospital Bethesda, and then all of the tests started then.
Right.
The biopsies to find out what was the case. I lost my kidneys.
Right, and that's why we're thinking, if you do a deep dive on this, for an adult man who's really healthy, who's 31 years old, again, no steroids, no drugs, no alcohol, nothing at all. Is it this post-streptococcal glomerular nephritis, or is it something called membranous glomerulonephritis, again, or lupus or something? It's definitely not lupus, right? We did a deep dive on this, and you've been a patient of mine for years, and so I want you guys to really understand, when you're looking at public health or you're looking at medical conditions, you need to look from a public health standpoint. What's the most common for a man like this at that age with his medical background, otherwise no contributions? You just look at the top three, that's a differential diagnosis. And I'm not saying that you didn't have this, but I think some of your doctors have questioned, was it really streptococcal post? Or
Yes.
was it membranous, or was it something else? And when you had the kidneys don't typically go down overnight, right? In America, if you go to dialysis, they're older, they're not 31-year-old healthy men or women. It's going to be older, and they have years of diabetes and hypertension.
Right.
Please, guys, you got to really pay attention to the silent diseases. So with you, your kidneys took a hit. It was one of these primary diagnoses that are pretty rare, right? In America, he's an American man, that at that time, it's going to be close to 1 out of 100. It's one of these low numbers, not from hypertension primarily or diabetes, but the hypertension, you were hypertensive as
a post.
Right. So guys, you have to understand, what the kidneys regulate electrolytes, and they regulate blood pressure. They work with the heart, the kidney. These are my babies, right? That's about cardiorenal. And that's why I'm doing this. And it's such a great example here, for what could go wrong. And with the medical knowledge, and because you're vigilant on it and you've taken such good care of yourself, you're 61, and you should see this guy, and he's so healthy.
Yes.
So, okay, you're on dialysis for how long in America until you get the first transplant?
I was on dialysis for 3.5 years.
Whoa!
At first, I was going 4 times a week because of my size. And then I would say, expert created this double filtration system,
Right.
which allowed me to go down to 4.5 hours, I was doing it 3 times a week. And then after 3.5 years, one of my clients, Ellen Souvigny, I helped her lose 60 pounds. And she came to me one day and said, "I want to donate to you." Of course, I'm like, no.
Come on.
No. And after arguing with her, for every time I had an argument, she came back with a solution. And finally I thought, okay, you can go get tested, thinking she won't match me. And she did. She
Wow.
matched me.
So what year was that? How old were you?
I was then in my mid-30s. We got the transplant in 2001. It was on October 2nd, 2001, Feast of the Guardian Angels. Went in, and I never felt better.
Dude. Now, how long did they tell you that was going to last?
At the moment, they thought about 6-7 years, and I went 18 years with that kidney.
All right.
18.
So that kidney lasted a long time, and you were
Yes.
a patient of mine during that time?
Yes.
Now let's talk about, again, we're not putting doctors down. This is awareness. So He never did steroids. He had low testosterone and he had low hemoglobin even after the transplant, because it's chronic kidney disease. Even post-transplant, there's an effect with the kidney, with the erythropoietin on the red blood cells. And when you're on testosterone and steroids, feast or famine, we have too much red blood cells. It's the opposite when you have chronic kidney disease, even after transplantation, in many instances. This guy was anemic. They did a great job.
Yes.
And
I was doing tons of epogen. They changed the regulations on it, and I was hurting.
He was hurting. He comes to me, and he's, again, your T was low.
Yes.
Wasn't definitely in the back. What was the level? Do you remember?
I can't remember. It was low, but
like 250, 300.
Yes.
It wasn't like 100.
Right.
But and he came to me in Connecticut. This is 12 years ago or something. I don't even know how long.
Right.
So, and I was like, I don't know. I got to be careful, Will. But I was like, I don't know, man. Seems like we can give you testosterone, and you're anemic, and like you're on all this erythropoietin on and off, and it's working, it's not working, and I'm like, let's try some testosterone because you have low testosterone,
right?
Really, not from steroids, not from anything else, and you have it because of the chronic condition,
yes,
and just your age and the whole 9 yards. Yes. We gave testosterone. Felt like a beast, not to mention the body. You should have seen the body changes.
Yes.
That's underlying the great genetics and the training and all the lifestyle. And then his red blood cells go up and he feels great.
Feels great. Come off the other drug, feeling great. And
come on. And then I did talk to his nephrologist. I'm very humble about that.
Yes.
What did she say?
She said, she was shocked and she was very open to it. And she said, we have to look at doing this with our other patients because my hemoglobin was so low all the time. I was highly anemic.
So, and I know now that doctors are looking at men that have chronic kidney disease before transplantation, post-transplantation, during dialysis. They know that most of these men are going to be anemic and suffer because they feel horrible, they're exhausted, and you should be looking at testosterone. For you guys, think about that. Vigilance is everything. So understanding it. So he's been on ever since with me. We've had a great run.
Yes.
Your kidney comes to a point you need a new kidney. How many years ago?
That was coming up June 1st will be 4 years.
Wow.
And so I went back on dialysis. This time, fortunately, I went 3 years. They were expecting 5 or more. And there were many people that were coming forward to get tested for me, and I appreciate all of you.
Wow.
Then one day I was called in and they were explaining to me, if another person, they have the swap program, which is great. If you don't match the person, you can give your kidney to someone else to put you at the top of the list. And he was telling me we didn't want a kidney to come from California and all of this. And he's explaining how they look at kidneys. And I'm thinking, why are you telling me this? I know this already. He said, well, we have a nurse here in Maine who wants to donate to someone, and she matches you. My world was just shocked. And after he said, do you accept it? And my one doctor, other doctor I trust with everything, Dr. John Vella, said, it's a good kidney. I said yes. And he goes, okay, I'll see you in 2 weeks. My world turned upside down there.
And now your kidney function is better than the first one.
Kidney function from my donor, Catherine, who is a retired nurse, is better than the first. My creatinine is less than 2. My hemoglobin is up in 11 and 12, who's never been that, right, even with the first.
Right, and that's low normal, right? Yeah. 12, 13,
yes,
even, but for you were down to 7, 8.
I was sitting at 7, 8 was high for me.
On EPO.
Yes.
And then the testosterone. So, wow, it's just an amazing story, dude.
Yes.
And how do you feel?
I feel great. So much so that's why I'm just dedicating myself to help these other people, because there are others who come to me who've had transplants or needing transplants, as well as others. And it feels good because I've already walked in their shoes. So it's good to pass on the knowledge that you and others have taught me to actually give them a better quality of life.
Where can people find you? What are you doing? Tell us what are your
my gym
goals?
is called BetterU. my goals, and the company we started was Refuse to be Feeble. You can find us on YouTube. We're trying that now. But my goal is to help anyone who comes through. I mean, I train professional athletes. I've trained musicians. I have musicians now that I train. But it's those people who come in. We call it the island of the misfits. Those who have...
Where is this? Where?
This is in Brunswick, Maine.
Oh, yeah. Way up.
Yes. And so those who come in with the, the disabilities where they've had certain things who say, I can't do it, we show them our goal is to say, be stronger than the affliction. That if you keep yourself strong, you can overcome anything.
And training. So you're an expert in training. You're an expert trainer.
Yes, we been doing it for a good while, and it's all private, so people don't have to feel uncomfortable around others. And I love it. I love seeing the people who change. As I was telling you about my one lady who has MS. Who's falling all the time, and she hasn't fallen in 2 years.
Wow.
She's doing great.
Wow. Mm-hmm. Any closing remarks for any of the brotherhood out there with the young guys that we love so much that are brothers from different mothers, and they're doing androgens, and I did it, well, you didn't do it, but right, you don't hate on me for what I did.
No, I don't.
I bust his balls here. But it's like, what do you say? We're also men that are older, but we're not that old. We still got you, kid.
Right.
And what do you want to say?
I want to say, it's never too late. There's no time stamp on our bodies to say you can't do it. It drives me crazy when I hear people say, well, my best shape was in high school. When I look at their pictures, I'm like, well, you were out of shape then, and you're out worse now. So you can get it back. You can be stronger. You can live a better quality of life. And it doesn't take exercising 7 hours a day.
Right. Focus.
Just 3 times a week, 45 minutes, I have a person, and you focus on you first. And if you do that, you can find yourself doing so much more, even in our 60s and 70s.
Right. And testosterone, what do you feel about testosterone out there?
For me, I take many drugs. It's just one shot that I take, and I tell you, my hemoglobin, my quality of life has been so much better. No more aches, no more pains. I was in a depression.
Right, the mental health stuff. Yeah.
All the medicine you're on is
for the transplant.
Right. Even though I love it, the transplant is not a cure because you're on so many drugs. But it helped me to help myself.
Wow. So just want you guys to be aware, this is a super cool guy, and it's a cool case. It's a rare case. I told you guys about that. It's rare. Definitely didn't do it to himself. And if you hurt yourself and you hurt your kidneys with steroids or drugs, and it just happens to you, I don't bring discrimination on you. I don't hate on you for that. You shouldn't be belittled for that. You should help yourself and move forward, and then bring the light to yourself and to others.
Yes.
And that's just what it is.
That's what it is, yes.
From a brother from another mother, thank you so much,
Thank
Will.
you, sir. Appreciate it.
Guys, let's get some great comments about this case. Thank you, guys.
Yes.